of African descent in Nova Scotia. And indeed, we are recording this because we want to have it available uh, to folks who weren't able to make it or who would like to just hear it again. And we'll have that on our Hawk YouTube channel, and we'll talk about that a little bit later. But right now, we want to extend a nice warm welcome to you all this evening. And so I will introduce myself. I am Sharon Davis Murdoch. I'm the co-president and the founding member, or a founding member, not the only one, a founding member of the Health Association of African Canadians. And I am joined by the outgoing co-president, long-standing co-president and great advocate for Hawk, my sister Donna. And Donna, over to you to introduce yourself.
Hi, I'm mic's on.
You're good.
Okay, good. Hi, I'm Donna Smith Darrell, and as Sharon said, I'm the outgoing co-chair of the Health Association of African Canadians. And this is very exciting. I'm glad to see everybody here. And I'll turn it back to Sharon and we can get on with it.
Well, yes, we can, except first of all, I do want to acknowledge and thank our administrative coordinator, Carla Williams, who, like in all cases, pulls these things together. She is the technical genius and the mainstay for us. And she doesn't always want to say hello in person, but she's there and she's navigating and managing the traffic. So Carla, welcome to you and thank you to you.
You're welcome and hello, everyone.
And I want to say first and foremost that we are welcoming you, and we are certainly recognizing that this is Indigenous land. I'm not going to do a land acknowledgement per se, but I am absolutely going to respect our Indigenous brothers and sisters. And in saying that, we are on unceded territory of the Mi'kmaq people. And indeed, this evening, it is a collaboration between our organization, the Health Association of African Canadians, and Nova Scotia Health that allows us to have this chat with you tonight. For those of you who don't know, and I don't expect that there are too many of you who don't know this, but the Health Association of African Canadians, the acronym of which is HAWK, as opposed to HAC. HAWK is a nonprofit health association based in Dartmouth, Nova Scotia. We are 23 years old this year. Our mandate is to inform health issues concerning African Canadians. These include education, research, healthcare delivery, and policy reform. The Hawk vision is thriving, healthy African Canadian communities in Nova Scotia, and our mission is to promote and improve the health of African Canadians in Nova Scotia through community engagement, education, policy recommendations, partnerships, and research participation. So that's who we are, and we aren't going to spend any more time telling you about that, but we are going to tell you about our event this evening. And we really are here as a result of a few conversations that we at Hawk have had with your very capable representatives from Nova Scotia Health, and particularly the young and wonderful Kaisha Benton, who has really pulled this together with us in an effort to do three things tonight: to learn what mental health services are out there for people of African descent in this province, to hear from mental health professionals and hear how they will describe their services and how to access them, and as well to help identify the gaps and how we can get more of the services we need for different ages, different communities, because we are not homogeneous, we are heterogeneous. There are many, many of our communities in Nova Scotia. And certainly we need to think about those who are incarcerated and the extent to which we are reaching them with mental health services. So here is an opportunity for us to do just that. We certainly want to encourage participants to ask questions, to get clarification, and identify what the gaps of services are. You may have a different take, a different experience than others. This is an opportunity for you to be heard and for us to talk about it. As well, it is really important also that our health professionals are able to talk about how each service or the service that they provide might differ from somebody else's service, because there are many of them and we want some clarity. We want at least to have the opportunity to get clarity on how services that are across the range of needs differ from one another, so we know what we need and when we need them. Okay, so having said that, Donna, you are going to talk about a little bit more about what we're going to be doing this evening.
Thank you, Sharon. So as Sharon has said, this evening is a collaboration between the Health Association of African Canadians and the Nova Scotia Health Authority. And so we're going to be providing information, but also we want to hear from people about the health system and how it's serving them. It's also helpful to remember that we're looking at different age groups of people. We're looking at children, adults, and seniors. We're looking at the diversity within our different communities. That is, those of us who are African Nova Scotians and people of African descent who are born outside of Nova Scotia. We're looking at people whose language is not, whose first language is not English. We are looking at the two-spirited plus LGBTQ communities, people living with disabilities, and most importantly, people who are incarcerated. So with further ado, I will turn this over to Kaisha.
Thanks so much, Donna and Ms. Sharon. Hi, everyone. My name is Kaisha Benton. I'm a community outreach worker with the Cole-Harbour Community Mental Health and Addictions Clinic, and I'm happy to be here, happy to see everyone here. I'm just going to introduce myself a little bit before I turn it over to introduce the presenters we have today. So I have a rec therapy degree. I also have a social work degree, and in the fall I'll be starting my master's of social work.
Yes.
And I always like to tell individuals I'm a proud aunt of my nephew JJ and my niece who's about 2 months old, Kalea, who they have really impacted my life in so many different ways. So I always like to say that. Before I turn it over to the other presenters, there's just something I wanted to share, which was something that I created in collaboration with Ms. Sharon. And also before I share it, I will let folks know that this is, even though this is the final copy right now, it's a draft in a sense where it can always, it can always change. There's always ways we can improve. And I will be hoping to do some more research to make sure that it encompasses more mental health services in our rural areas. But I do know, unfortunately, that is an ongoing gap that we've been having. So I'm going to show you what me and actually also Miss Carla also helped a lot too. So it wasn't just me. But can folks see this?
Yes.
Okay. So basically what we've called it right now is a mental health and addiction services tree. And what we were finding was that there really wasn't too much of a visual for folks to be connected to not only mental health care professionals, but also mental health healthcare professionals of African descent. So we have here, step one, and we have, some of the presenters and the services that are here today. We do know that there is more. out there, but we have some here to kind of start you out. And then also too, we have some other supports in the community as well. So just quickly, this is kind of the first step when you're kind of thinking and looking for mental health support. So we have Lana McLean and Associates, the People's Counseling Clinic, Lisa's Holistic Rehab and Neurofeedback, the Pause Clinic, which is through the North End Clinic, which offers free telephone counseling sessions to adults. They also help with grief, relationship challenges, anxiety, and situational crisis. We have the Association of Black Social Workers and the Health Association of African Canadians, which have very big roles within our community and are a really good place to start when you're trying to navigate to figure out more mental health services within the community, especially for individuals of African descent. We have our Nova Scotia Brotherhood Clinic, and we're very excited to know that the Sisterhood Clinic will be coming. So we don't really have their number yet, so that's to be announced, but I did see that there was positions being posted, so that's really good to see that that's going to be started. We have our Nova Scotia Health and IWK intake line. So that's the line where you'll call to be connected with someone from, if you meet criteria, to be connected with someone from our Community Mental Health and Addictions Clinic for adults and youth. We have our mental health mobile crisis line and the kids help phone lines, which is 24 hours. And lastly, we have something that's been new in NS Health. It's a recovery center. So it's on Alderney Drive in Queens Square on the 8th floor. And it's a drop-in center for individuals with addiction challenges, which is, like I said, through NS Health. And there's, one-on-one addiction support, programming, and many other things to help support folks. Then in step 2, so kind of what happens is, depending on if step 1 is enough, then you kind of would stay in step 1. But if not, we do understand that individuals may need some more ongoing support, as well as having some folks in step 1, and that's okay. So some of the things in step 2 we have is, being connected to a clinician or a community outreach worker such as myself, a psychologist, or a psychiatrist through Nova Scotia Health or the IWK. You may need to visit the emergency department to speak with their crisis mental health services, or you may need to contact withdrawal management, depending on the circumstance. And then the third column here, so we have when you need care for what we would say is kind of complex mental health challenges or addiction treatment that may require hospitalization. You can be connected to a Black mental health care professional. And so those examples of those would be kind of if you were admitted to the inpatient services. And so within HRM right now, we have the Nova Scotia Hospital, we have the Abby J. Lane, and the Guerin Center for Youth. Also for our adults, we have what's called Simpson Landing. And so that's in which when you are admitted to hospital, they would refer you there if you meet the criteria. And then also we do have outpatient services. So you wouldn't have to stay in, you could still get services through an outpatient lens through the Nova Scotia Health, through Nova Scotia Health or IWK. And then also through those clinics, you would have the chance to be referred to Connections Halifax or Connections Dartmouth. So as I said, this is just kind of, the start. We just wanted to have something out there, a visual for folks to be able to see. But at the end, we will provide you with an email that you will be able to, send any feedback or anything you would like to see or anything you felt that was missing. So I want to make sure we're very apparent to that this is something that's not set in stone and that it can always be changed. And we're definitely open to feedback for sure. So without further ado, I'm going to get the presenters to introduce themselves briefly. So first, at the top of my list here, we have Mrs. Lana McLean. Do you mind just briefly introducing yourself?
Well, good evening, family. Lana McLean. I'm a practicing clinical social worker for about, for about 35, close to 40 years now. I have a small private practice located in downtown, well, not even downtown, we located at 99 Wise Road in Dartmouth. I have in my private practice, We offer a range of services, both from forensics to individual work and different treatment modalities. And for most of you who may know me, I'm originally from Whitney Pier, Cape Breton, so I'm a Cape Breton girl. Kind of lost that status, I think, since I really don't go home very frequently, but married to an amazing man, Thane Pleasant. We have a wonderful, phenomenal 12-year-old, Ella, and look forward to spending time with all these wonderful learned friends of mine on the phone, on the call.
Thanks for that, Lana. And next we have Lisa. Dennis?
Yes, hi, Pam. I'm really happy to be here. My name is Lisa Dennis. I work in rehabilitation medicine for about 23 years now. And I'll talk more a little later about the different treatment modalities that I do, but originally from Montreal, born and raised, and to Trinidadian parents, to two great teenagers, 13 and 16 going on 20, but, yeah, I'm really busy in the community, enjoying doing some of the work that I do. So I can't wait to tell you more about that in a little while.
All right, thanks so much, Lisa. Next we have Miss Cynthia Jordan.
Hi, folks. Cynthia Jordan, originally from Guysborough County, Nova Scotia. I'm a mental health nurse. I've been nursing for about 16 years now. All my experiences in mental health and addictions. I worked a stint in the province and then transitioned over to the federal government, and currently working out of the North End Community Health Center as mental health manager, where I'm managing the PAUSE clinic. And looking at building the service to better suit the community, and always particularly my eye is on what are the needs of the African Nova Scotian community, and keeping that in mind moving forward. I am the proud mother of 4, 2 of which I birthed and 2 of which I adopted, and it was a kinship adoption. So it wasn't like I went looking for any extra children. They just happened to land with me, and I'm very pleased and very blessed to have them in my care and to be able to support and provide for them. Outside of that, that's pretty much me in a nutshell. I do some of the cultural impact assessment stuff with Lana, work very closely with her and with Robert's team around those assessments. And yeah, so that's me. Thank you very much, and I'm pleased to be here.
Thanks so much, Cynthia. And next, Aaliyah. Do you mind just briefly introducing yourself?
Hi, everyone. I'm Aaliyah. I'm the outreach social worker at the Association of Black Social Workers, and I've been in Nova Scotia since February. So I have a lot to learn here today, and I'm excited to be here. Thank you.
Thanks so much, Aaliyah. Next, JJ.
Good evening, everyone. My name is JJ Wilson. Born and raised in Dartmouth, Nova Scotia. I graduated from the Dalhousie Social Work Master's Program in October now. And in that, I was doing a placement at the People's Counseling Clinic with Robert Wright. And when I finished that placement, I was able to stay right on with employment with Robert and his group at the People's Counseling Clinic. So I've been there as a therapist, I guess since I graduated in October up until now. Yeah, thanks for folks for putting this on, because this is a great event and I look forward to it.
Thanks, JJ. And next we have Devon.
Hi, folks. It's Devon Bundy here. I'm a social worker and health services manager with the Nova Scotia Health Authority, responsible for overseeing community health and wellness centers in the Preston area, as well as the Nova Scotia Brotherhood, and super excited for the expansion of the Nova Scotia Sisterhood. Born in Halifax, raised in the North End in Mulgrave Park, and my family originates from Cherry Brook. Happy to be here, happy to see everyone.
Thanks so much, Devon. Dr. Vincent, you're next.
Yeah, so I'm Vincent Ajapon. I'm department head for psychiatry for Dalhousie University, and also the chief of psychiatry for the Central Zone. I've been in Nova Scotia since September. Prior to that, I was in Alberta for 8 years and in Dublin for 10 years and in the UK for 2 years. I won't say where else you put my age together. I'm very excited to be here. Thank you.
Thanks so much. Next, Stephanie.
Hi there, good evening, everyone. Very excited to be here. Thank you again, Kaija, Sharon, Donna, everyone for putting this on. I am working currently as a clinical therapist with the Community Mental Health and Addictions of the Cole Harbour Clinic. And part of my role is also looking specifically at the Preston Township. So I also have clinic days in East Preston and North Preston. I'm also a registered occupational therapist. I've had the privilege of working inpatient mental health. So I've been with CTP, which is Community Transition Program out in Sackville, and also with Simpson Landing at Nova Scotia Hospital. So yeah, I'm excited just to learn more from everyone here today, because I know a lot of the times we work in silos. So this is really nice to get a kind of more of a bigger picture of what everyone else brings to the table to help spearhead more of like mental health services for Black folks. So yeah, again, thanks, and look forward to hearing from everyone.
Thanks. And Stephanie, you were very instrumental in creating this event as well. So I want to make sure folks know that too. And last but not least, we have Krista.
So thank you for inviting me tonight. I'm really excited to be here. My name is Krista. I'm a registered nurse. I work as education coordinator and intake coordinator at the Nova Scotia Early Psychosis Program. And right now I'm leading a project based on a study by Dr. Waldron and Dr. Cookie that I'm really excited to talk about with you guys. So thanks for having me. I'm looking forward to hearing from everyone too.
All right, thanks so much, Krista. And I'll pass it over to you, Sharon, for the next segment.
I think it's Donna.
Okay,
Donna,
sorry.
you wanted to mention something to the participants.
Okay, sorry about that.
No worries. Donna, you're muted.
Oh, I'm just looking at, okay. So, yes, okay, so after the presentations, the participants can keep their comments in the chat and until about 7:15, and then we will facilitate questions from everyone after people have given their presentations.
Right, and I jumped the gun, so it's my fault. But hey, no fault. We're just going with the flow.
Right.
So what I want to do is I'm going to ask the speakers in the order in which they were introducing themselves, and remind you if you forget what that order is. And we are going to use this opportunity to hear from you, professionals, about number one, what the mental health services are that you provide.
Right.
Number two, how is your service different from other Black mental health services in Nova Scotia? And finally, what is your greatest challenge in delivering your service? So you don't need to, be too hung up on whether you're answering number one first or number three first, that's fine. But we do want to get those answers from you in up to 7 minutes. You don't have to take 7 minutes, but you can't take 8. Okay, so with that in mind, I think first up would be Sister Lana. Unmute yourself, Sister Lana.
Thank you. Sorry about that. Well, thank you. In 7 minutes or less. So as I did in my introduction, I have a small private practice with which is expanding my associates. So I have associates who do individual, family, and couples therapy across the continuum from ages 10 to 65. We kind of cut off at 65, particularly if someone is presenting with some mild cognitive impairment, but we certainly can refer people into the seniors mental health program or to geriatric services. We can help navigate families in that domain. So our clinic offers, like I said, a menu. So we do individual, family, and couples therapy, 10 to 65 years of age. Nothing about 65 and older. I just think it's a very nuanced population, which requires a little bit more specialization. When I work with seniors, working with seniors is like working with children or adolescents. It's family work. It's not just always individual work. So, I take a very much an Afrocentric approach about our practice. So we do an individual, family, and couples work in that demographic age. We also have clinicians, including myself, that do forensic assessments. So we do what's called impact of race and cultural assessments on criminal matters as part of the umbrella of the African Nova Scotia Justice Institute. I do training of a small team that is affiliated with the larger team. So we do cultural formulations, a biopsychosocial assessment with provisional diagnoses of people who present, like a conventional assessment. I am one of two people in Canada, Robert is my colleague, who are qualified by the Supreme Court to write those assessments. And so we do co-teaming and co-teaching with others. So forensic assessments in criminal matters, forensic assessment in family court matters, both in private and child welfare matters. So matters before the court when children are taken into care. We write assessments that are culturally specific so the court has an understanding of the family's functioning. It's probably something our team does different than most other maybe Black mental health services. Our assessment team is very high functioning and very sought after around those particularly forensic assessments in both family and criminal courts. And then there's the consulting part of our company, where as the primary lead, I do consultations with government, right now, we just finished a 1.5-year long consultation with the IWK Mental Health and Addictions Program and helped develop a African Nova Scotia family and youth program that I believe they got core funding from. So we have and developed some training modules for those folks who are going to be into those programs and integrated service model delivery system. And I do some consultations with major corporations in Canada, whether it's the CBC, Desjardins, or even law firms around cultural competency, cultural capacity building, anti-Black racism. So we do some consultation around anti-Black racism within the domains of those particular organizational government and private sector organizations. And even in non-for-profit, we do consultations with their HR department on issues of anti-Black racism in the workplace. So we have these various different menus. The clinical piece, you can ask me a little differently about how about what our staff are trained in. All of the folks that are a part of my team have training in both psychodynamic therapy. We do a race and trauma informed care and helping our community have a wider understanding of the impacts of intergenerational trauma, colonialism. We also do some consultation, I should say, with newcomer communities, particularly with the ISANS community. We do some pro bono work. Everyone who's attached to the Lana McLean and Associates is required as part of our team and our ethical standard to do at least at minimum 15 to 20 hours of pro bono work, whether that's in clinic, doing individual work, or if that's doing some consultation in community. It's those Afrocentric principles of building as we go. And our greatest challenge, how are my minutes doing? I think our greatest challenge is we're super busy. My wait list is until September, maybe early October, before I take on any individual folks. Our team also does a subspecialty with military families, active serving members. We do a lot of race and trauma informed work with military members who are racialized. So a lot of our work is trauma and race informed. We do some treatment modalities, include DBT, CBT, psychodynamic, solution focused. We also do a pro bono group for adults or parents who've lost a child to death, well, lost a child, either in a tragic or in all loss of children is a tragedy. But we do a small closed group every 21 months. So it's a process group, and it's co-peer led with myself and another person who would have graduated from the program. And that's some of our pro bono work that we do. So it's complex grief, work with adults who've lost children. And as you know in this call, that there's been a fair number of parents who've lost young Black men to gun violence in our community. And so that's been a way for them to access. We do consultations with the province and various different departments as well. Primarily the Department of Education, looking at system delivery and working with folks like Schools Plus. So our biggest, we've got lots of little accomplishments, but our biggest one is the implementation of the African Nova Scotia treatment team through the IWK, which we hope will be launched very soon. Been a couple of hiccups, and I think we got them.
Thank you ever so much. That was quite a lot, and we'll have an opportunity to unpack it with some questions following. So over to Lisa for your 7 packed minutes, Lisa.
Yeah, you know me too well, right? So hi, everybody. Thanks for inviting me here. I just want to get it to the current slide here. Perfect. So I, like I mentioned, I've been working in rehab medicine for about 23 years now. I'm also a doctoral student at Boston University, working on a doctoral project that I'll tell you about in a moment. I teach at a private college, but I'm also the proud owner of Lisa's Holistic Rehab and Neurofeedback, where I deal a lot with brain-based disorders. And the reason why I do this is because I struggle with many brain-based disorders in my life, starting with childhood trauma, the anxiety and depression that came along with that, tons of concussions, poor attention, and everything, whatever can happen to a brain has probably happened to mine. So I found ways to heal my brain. And so I'm now the brain rehab lady helping others. So one question I always ask is, would you get a track and field coach to force you to sprint if you're on a sprained ankle? Or if you woke up one morning in a hospital bed and you weren't able to feel your legs, and would you want me to prescribe a wheelchair to you right away, or do you want to try to walk again, right? And so I think in the rehab world, when it comes to physical problems, it's pretty clear that we want to rehabilitate the body to get back into its shape. But when we talk about the brain, we don't really talk about the brain this way. And I think this is one of the challenges for me, is that people think that you're stuck with the brain you have, and that's not true. So I work with people that have concussions, post-traumatic stress disorder, multiple sclerosis, dyslexia, sensory processing disorder, anxiety, depression, but also auditory processing and other sensory issues and developmental delays or reading difficulties. And I work with people of all ages, from young kids to older adults. And my goal is to help people live to their full potential. In other words, helping them rehabilitate the brain. Speaking from Montreal, I also speak French. Donc, s'il y a des personnes ici qui parlent français, je peux vous donner un service en français, pas de problème. Et aussi, je peux vous aider à naviguer le système ici à Nouvelle-Écosse. So some of the symptoms that I deal with is, I can't get myself to do the things I do. I can't remember names. I can't remember what I hear or read. I can't seem to think ahead. I can't remember long directions. Can't learn things quickly. I do or say things I later regret. Can't sit still for very long. Can't keep track of time. Everything seems to distract me. Can't seem to work quietly, losing things that you need later, starting projects, never finishing them, avoiding crowded places, irritated by sounds, lights bothering people, headaches and dizziness that's not going away, reading difficulties, sensory issues. So basically, I'm working with all of these different diagnoses, including the mental health issues. But the goal for me is to rehabilitate the brain. So I don't do talk therapy. So you're not lying on my couch and I'm not talking. Yeah, I'm going through, your history. I leave that to the Lana McLeans and everybody else that's on this call. I'm really concerned about, is your brain working to as efficiently as possible? And I use different treatment modalities to do that. So, the tendency when we talk about the brain is that you're stuck with the brain you have, and you only have to take a compensatory approach, like coping strategies, which is some of what I do. But I focus more on the rehab side, and that's helping people restore their function, get back to their new level of function, and by learning new skills. So the challenge in my world is that people don't realize we can actually rehabilitate the brain. So I really get to the root cause, and for really, holistic assessment, just getting to know the person, their mind, body, soul, what's really important to them, and what issues they're struggling with to kind of, and then I deal with it in a very systematic way. And I'm using the principles of neuroplasticity. I don't know if anybody knows, but we used to think that the brain was hardwired and you were stuck with the brain you had, but now we know with research that even in all ages, definitely for children, but also for adults, there are ways to make that brain form new connections. And we call that neuroplasticity. And there's so my treatments involve different principles of neuroplasticity, in that frequency is important, intensity is important. So people have to come frequently to be able to get that change and to see that change over time. So one of the things I offer, I'm the only one here in east of Fredericton that's offering neurofeedback. And basically this is a way to really regulate the nervous system. So sometimes people aren't ready for talk therapy. And so neurofeedback might be a good tool in terms of helping them calm down their nervous system to a place where they're reacting differently and more healthy to different situations. And then they're ready to talk it out later on, or vice versa, right? It works really well complementary to talk therapy. So I'm not working on the mind. That's what the talk therapy is for. I'm working on the brain as an organ, making sure that organ as a brain is working efficiently. Neurofeedback has been around since the 60s, maybe even before that. And basically how it works is I put a cap on you and we record brainwave activity. So this is brainwave activity of somebody, probably myself. And basically the feedback, I put that information through a database, and we find out what areas of the brain and what brainwave activity is happening. And we try to regulate that brain by giving feedback either through animation on the screen that starts and stops. And when it's moving, it means you're in the right zone that we're trying to train you in, or you might hear a beeping sound. Typically people need to come for at least 20 sessions for it to be to take hold. And it's no less than twice per week. So that's one of the things that we do. Really great success with trauma, like night and day for some people. Like it saved my life. So, I definitely offer it. Other things we do is offer listening programs. There's a difference between hearing and listening. And sometimes when people have attention problems, it's because they're not processing that sound properly. So a lot of children with ear infections, for instance, grow up with problems in the inner ear and are not listening. And that's why they're having troubles paying attention. So it's about, screening and making sure that we're covering all our bases to find out where the attention problems are coming from. And then the listening program is there to help train that ear to process that sound better. Sometimes people have trouble reading. Sometimes people have these distortions on their page, words moving on their page due to a concussion or even trauma, or light sensitivity. And basically this is not something you can tutor away. So if the child is saying that their words are moving on their page, that's a neurological problem that needs to be addressed, and you can't tutor that away. So what I do is I'm the only one here. There's two of these machines. It's called a colorimeter, and there's two in Canada that I know of. I'm one of them, and we offer filters. So we find the right precise color. I have my own pair that has really helped me, and it really calms down again the brain. that information better. So even people with trauma have helped this. I've been helped with this as well. And then as part of my doctorate, like I mentioned, I'm a doctoral student at Boston University. My project is on essentially rehabilitating racism. Racism is a disease, and just like any other disease, as a person with rehab background, it's about how do we help make that better. So, I talk a lot about the goal is to help teachers recognize their bias so that little Black boys and little Black girls don't end up on the school to prison pipeline. So that's part of the doctoral project. So I'm very much interested in trauma, in the school to prison pipeline, and adverse childhood experiences, so ACEs. Little kids are being expelled and as young as preschool. That's a problem. I have an office in Halifax. I'm looking at moving somewhere, maybe, I don't know when, but soon. We need a bigger space, but happy to help you. Just give me a call and come to my website or whatever, and we can help you live a really productive life. Thank you.
Thank you. That was fantastic. Thank you so much. All right, over to Cynthia Jordan now.
Hi, thank you very much. Hi, Lisa. It's nice to hear that you're doing the neurofeedback. I really am a fan of that. And yeah, I was looking at doing the training a few years ago, but we'll talk offline.
Okay,
so
thank
Cynthia
you.
Jordan, mental health nurse, working out of the North End Community Health Center. Right now, currently, my primary role is managing the PAWS mental health line. And the PAWS mental health line is a free, accessible 1-800 number line that is available to anyone in HRM. The number is 1-800-598-5270. There was some funding that we had attached to the PAWS mental health line that was the United PAWS mental health. And that was a bit of funding that we had to provide services specifically towards the African Nova Scotian community. So therefore, anyone within the African Nova Scotian community, including outside of HRM, were able to call the PAWS clinic, which is basically was initially set up as a walk-in, but as a result of the pandemic, we started doing telephone services, and we found that really a hybrid model would be best served and meet the needs of the clients within our community. So as part of the PAWS mental health clinic, we have an African Nova Scotian navigator who is currently Tara Downey, who holds that position, and her job basically is to navigate other programs and services or organizations or agencies within HRM to discern what the needs of the community is, and so that we can provide services where there are gaps, or try our best to provide services where there are gaps. And so some of that work includes like navigation, includes providing resources such as helping folks navigate housing authority, community service, child protection, all sorts of different things that impact one's mental health. Under the PAWS Mental Health Clinic, we currently have 2 clinicians. We operate on Tuesdays, Wednesdays, and Thursdays from 9 until 5 p.m. We were approved again for core funding from the Nova Scotia, I don't want to get this wrong, but it's Department of Health and Wellness. And our funding is annually. So one of the things that we do as part of our job at the North End Community Health Center is helping to identify, like I said, where the gaps are and looking at what sort of funding we can go after in order to increase the services to our community. One thing about the North End Community Health Center is that it operates as a community center / clinic. And we have the ability to, hire healthcare professionals within that model and look at innovative ways of how to deliver services that aren't necessarily layered by the bureaucracy that sometimes folks have to go through within the larger system. So we do have a lot more flexibility in terms of the programs and the services that we offer at the community level, using best practices and modalities in which are evidence-based. So we do partnership with ABSW. We partnership with the Health Association of African Canadians. We also partnership with the community mobilization team, also the Brotherhood, and soon to be the Sisterhood. So any sort of things that we can do to provide support, I and my team, we will do our best to try to support those programs, whether it's psychoeducational groups or whether it's assistance facilitating process groups within the community. Some of the things that we do is in terms of the rapid response is if the community identifies that there's a need for a grief group or a follow-up session within the community that has experienced violence, whether it be gun violence or whether it's sexual violence or other, issues that are happening within the community, any grief-related issues, we can mobilize a team, and our team can come out and provide, drop-in kind of rapid response services and continue to partner with other organizations in figuring out innovative ways to be able to provide services within the community. So I don't know where that leaves me in.
I'm not sure what happened. We lost Cynthia, but she didn't take every. Oh, there you are.
Oh, sorry.
You have a minute. You have
my
a minute
internet.
to wrap up if you wish, or you're good if you want to
Okay.
leave.
I will
Leave
wrap
it
up.
now.
Yeah, I will wrap up with stating that what I find to be most challenging is navigating resources in terms of funding resources. That would be the most challenging thing, and not having consistent ongoing funding for community level programming. That's the thing that I'm finding right now. And the other thing is knowing and collaborating with others, what's available, what's out there. So I'm really happy that this is happening around the table. And one of the things that I'll just leave with saying in my last seconds is that I would really like to see us really to go back to the mental health strategy and really revisit that and see from the mental health and addiction strategy that was done many years ago, and look at what pieces of that are existing currently because of all the stuff that we're doing, and look at where do we want to focus and where do we want to build in a more purposeful, systematic way of approaching mental health and addictions care delivery in our province. Thank you.
Thank you so much, Cynthia. And there's lots of information there. I'm sure our participants would like to unpack a little bit more and ask some questions about. Okay, thank you. Over to Aaliyah.
Hi, everyone. Sorry, I'm just trying to get this. Okay, so as you know, I am the outreach social worker at the Association of Black Social Workers. So a bit about what we do at the Association of Black Social Workers. It's primarily, as Kayeja mentioned earlier, a system navigation support. So I am basically the person who connects a lot of our clients to various services that are available in the community. I'm typically the first point of contact at the organization. So people come to me when they're experiencing crisis, or if they're experiencing mental health issues in general and they don't know where to go. I'm the person that directs them to various supports. And I also do quite a bit of advocacy. So I find right now throughout the province, in different services throughout the province, there are long wait lists, and there are also limited options in terms of accessing Black clinicians. So I try to use the relationships that I have to boost people on wait lists and allow them to access services more urgently, because a lot of my clients do need urgent support. I also tried to identify and fill gaps that I noticed throughout the province, and I'm currently trying to put together an Afrocentric mental health program, and I have approached a private sector funder to make that happen. And I do provide basic counseling, and it's not clinical at all, just basically active listening and making sure people feel supported and affirmed. And my colleagues mainly provide peer and community support services for people who've experienced gender-based violence, such as vision board workshops, yoga sessions, and art workshops. A bit more about what our services entail. We are open to people of any age, gender, and sexuality, and we don't turn anyone away. Some of the differences I've found in ABSW services is that it's primarily a knowledge-based and relationship-driven service. And typically my role is to refer outside of ABSW. Also, I am not clinically trained at all. We don't have anybody in-house who is clinically trained or able to provide clinical services. Also, there is an educational component to our work. We do try to raise awareness about mental illness and normalize it in our communities. And finally, our service has a broad catchment area. Like I said, I don't turn anyone away. I get calls from people in Alberta looking for support, and I never say no. I always try to make sure I'm supporting Black people wherever they are. Some of the service challenges I've noticed, this is just research that I thought was really interesting and disturbing. As many of you I'm sure know, Black people have faced severe anti-Blackness in the medical system. Oftentimes they are not listened to and their concerns are dismissed. And also the biomedical model that the health system continues to use is harmful to a lot of Black people. A particularly interesting statistic is that 1 in 4 Canadians aged 18 and older screened positive for symptoms of depression, anxiety, or post-traumatic stress disorder in spring of 2021, which of course is, as COVID is getting worse, mental health issues are worsening, and at the same time, the cost of living is getting higher. People can't access the services that they need, and I will talk more about this on the next slide. But a lot of our clinicians in the province who are Black have a high caseload, and they're in high demand. So they have long wait lists, and they cannot accept new clients. Also, there are transportation barriers. As you guys know, many services are in Halifax, and there are few to no services in rural areas where Black communities may live. And so that makes it difficult for people to access services. Also, the cost of therapy is quite expensive, even on a sliding scale, which could be $80 per hour, is still quite a lot for a lot of our low-income clients who are underemployed or unemployed. Also, there are a lot of stigma and confidentiality concerns. People don't feel comfortable accessing things like group therapy because they don't feel like they can share, because people know each other across communities. And again, as I talked about before, white practitioners hold racial biases that cause Black people harm. And so there is a very strong preference for Black clinicians, even though the number of Black clinicians across the province is limited. And that's pretty much all I have. If you have any questions, you can reach out to me at outreach@nsabsw.ca. Thank you.
Thank you so much, Aaliyah. We really appreciate that. And you have kind of brought us right back onto good timing there. So I'm going to ask for JJ now to take his 7 minutes.
Certainly, thank you very much. So as I mentioned, I'm JJ Wilson. I work at a place called the People's Counseling Clinic. I've been there as a staff therapist since I graduated in October. So the clinic itself is a pro bono counseling clinic. We have different services. Right now, as it stands, we have 3 staff therapists on myself being one, obviously, and 3 students who are supervised at the clinic. And then there's also James Dubé, who's the clinic manager. And then Robert Wright is the executive director of the clinic. So we offer both one-on-one options, and then there's also group therapy options. So the two groups that the few groups that we've been running, Robert has ran Man Talk since 2011. And Man Talk is a group that's designed for male identified victims of sexual violence. So it's a group therapy where men are able to come and share their experiences around the sexual abuse that they faced in the past. And then obviously the clinical experience of Robert and James running that group and providing, different topics for different weeks allows guys to really connect with one another and heal that way. And then there's another group that we offer called Inside Out that has transitioned to be facilitated by myself. And that is a group for men who might be at risk of harming others because of past traumas, whether it be physically, sexually, mentally, or anything else. So we look to bring, it's a wellness group that we look to bring guys in to, once again, have a topic for the week sort of thing. And then, have myself give a brief explanation of the topic, and then open it up and ask questions to facilitate a conversation for guys to say how it has impacted them. And then also we are at the clinic, we are also one of the main service providers for the Halifax Domestic Violence Court program. So we run a wellness groups through our clinic focused on trauma and men's wellness. And then once again, another project that is housed through the clinic is Robert's involvement as one of the main contributors to the development and implementation of the Impact and Race and Culture Assessments, IRCAs for short. Also the African Nova Scotian Justice Institute, the Decade for Peoples of African Descent Coalition, and other anti-racism work. So I guess you could say that it's not a coincidence that myself as a Black clinician was brought into the clinic. Robert did want to expand services, that were aimed towards the Black community. So him and I collaborated before I did my master's, and we thought I could serve a role at the clinic to sort of open up some more projects that are focused towards the Black community. So some projects that I've been running at the clinic have been, one in specific was providing services to students, faculty, and staff at St. FX, culturally relevant services for students of African descent to be able to come and have, once again, pro bono services from a Black clinician. And then as well as going to different, connecting with various schools as well. And connecting with different counselors from various schools and going in and providing whether it be one-on-one or group options with students who have been identified by counselors at the schools to be sort of going through some things in their lives, going into those schools and sort of allowing those students to say what's going on with them and different things like that. So both our interns and staff therapists that we have, we offer counseling in areas of trauma, adjustment, grief, parenting, mental health and addictions, relationships, and attachment issues. Obviously, like I mentioned, it's a pro bono clinic, so we do work with many people who are, street affected clients or marginalized with many problematic behaviors. So we focus on obviously the trauma that these people have endured, and not focusing on the problematic behavior, but the reasons why the problematic behavior might occur, because as we know, people who are traumatized develop complex psychological, social, and behavioral problems. And treating and exploring this trauma addresses the underlying issues that can fuel the problematic behaviors, such as the use of violence, drugs, or other things that people might suffer from. But yeah, I guess I would say one challenge at the clinic that I've certainly faced for lack of better words, is that I am not Robert Wright. As a young Black male coming in, just sort of starting my practice and working under Robert. Many folks come to the clinic and they're like, I want Robert and nobody else, sort of thing. And it's almost like, who am I? So just having to be able to prove that I'm competent and able to serve folks in that capacity, has been a challenge. But obviously, it's a great challenge to have because it's very understandable. Who wouldn't want to be seen by someone with the tutelage of Robert? But yeah. So like I said, just under a year into the professional world, and I'm adjusting well, and the clinic has been a great place for myself to sort of adjust to that, and I've been loving it, and I'm learning so much every day, and yeah, it's a blessing to be in the position that I am. So thank you.
Well, you are JJ Wilson is who you are.
I
And
am
we're
JJ
delighted,
Wilson.
and we're delighted to have you among us, and to support you and your great work and your leadership as well, JJ. So just take the praise, man.
Oh, certainly, yeah, certainly. Like I said, it's a great It's a great.
We got you.
We've
We've got you. All right, moving on to Mr. Bundy, Devon Bundy. Take it away for your 7 minutes, brother.
Thank you. I'm happy to be here. JJ, you're awesome, of course. You know that.
Thank you, my brother.
I also
you as well.
asked my, well, there's only a few of us males doing this social work thing, so I appreciate you. I asked my colleague, Elizabeth, to turn on her camera to say hello too, so I'll give her an opportunity to speak quickly as well. But I just want to say that under our portfolio, or under my portfolio as the manager, I have the community health and wellness clinics in the Preston area. So one in North Preston and one in East Preston, but it services the whole Preston area. And that's almost a collaborative model. So we have a bunch of different providers that work out of those centers and a bunch of different professions: nursing, family practice nurse, nurse practitioner, doctors, dietitian. So a whole range of services that can help support the people in the Preston area. But for the purposes of this presentation, I'm going to speak specifically to the Nova Scotia Brotherhood and what it is we do. Keeping in mind that we have the expansion of the sisterhood coming, which is going to be somewhat modeled after the Brotherhood in terms of the format. But we're going to work very closely with Hawk when we hire on our staff team to develop a program and what the program looks like for the sisterhood. So there will be a focus on screening and mental health and things like that. So stay tuned, there's a lot to come. So I'll jump into it, and then Elizabeth, after I'm done this question, I'll just give you a chance to say hello and if there's anything you want to say. So the Nova Scotia Brotherhood has a family physician that does a mobile clinic in the African Nova Scotian communities on Wednesdays. He goes into East Preston, North Preston, North End, Dartmouth, Halifax, and Upper Hammonds Plains every Wednesday, and it switches. You can find that information, our schedule, on our website. We also have a program called the Men's Health League, which is a peer-to-peer support group for Black men to come and talk about a range of different topics to support each other. That's facilitated by our community liaison person, Dwayne Winter, who couldn't be here today, but he wanted to be. We also have, when the sisterhood comes on, we'll have a clinical therapist as a part of our team. So that person will most likely be a female, and she will be supporting both the sisterhood and the brotherhood in terms of clinical therapy. So that's exciting. We have our transcultural psychiatry, our brother here, Dr. Vincent Adjupong, who is spearheading that. So we're in partnership with them, and we have, that's usually at our clinic at the Brotherhood on Thursdays and Fridays, I believe. So we have a group of psychiatrists that come and see Black folks in our space at the Nova Scotia Brotherhood. I won't talk too much about it because Dr. Ajapong will probably, I want to leave some space for him. So that's super great partnership that we're excited about. And that has about a 2-week turnaround in terms of bringing people in from the referral to actually seeing a psychiatrist. So very
muted. You muted yourself, Devon. You're muted. Can you?
somehow I think the host is muting everyone and it muted me, which is fine. Yes. So what part did you miss?
You just literally 15 seconds.
Okay.
Before. Yeah.
So I'll move on. You guys get the gist of it. And then we have our Barbershop Talks, which is super famous, great hit in the Black community with Black men, where we're having conversations around mental health, racism, trauma. We recently did one 2 Mondays ago in North Preston that brought out a large crowd, of nearly 20 men from the community to talk about the effects of racism on them in the workplace, day to day, their relationships, struggles that they're having amongst each other. So we're going to continue with that. And that's a partnership with Mental Health Foundation. And we have our wellness navigator. So I'll let Elizabeth jump in and say hello. And if she wants to talk about anything, and then I'll take back over and wrap up.
I see that. I also see that Brother Dwayne is here. So maybe we can hear from both of you in fairness, and then come back to Devon. So
absolutely.
So Sister Elizabeth.
Well, thank you very much. I'm very honored to be here tonight. I was going to be hiding behind, but I'm so honored to be in a space with so many wonderful African Canadians, very intelligent minds right here today. I'm the wellness navigator for the Brotherhood. My background is nursing, and I've been doing a lot of mental health supports in the various hospitals for folks who are on admission and coming out of the hospital. Also helping folks to navigate and find resources in the community. So in a nutshell, that's what I do. Thank you very much.
Okay, thank you, Elizabeth. Brother Dwayne, you want to say hello and tell us about your work?
Good evening, ladies and gentlemen. Thank you all for having me here tonight. I'm the community coordinator for Nova Scotia Brotherhood. So my work involves building programs, making sure things run smoothly, just making sure the Brotherhood is out there within the communities that we serve. I'm not sure if Devon had mentioned the Time with the Lawyer, Devon?
Nope.
Okay, so that's another program we have on Friday afternoons where we collaborate with legal aid, and any African Nova Scotian male or female who has any legal issues, they can come to our office on Mumford Road, which is at the Mumford Professional Center, and they're able to sit and talk with a legal aid lawyer. It's all free. He will advise them if they have a case and so forth, just very transparent. And during that meeting, Elizabeth, our navigator, also sits with some of these men who might have pending cases and just have a hard time understanding the lingo. So it's been going now for, gosh, about 5 months now, and it's going really well. And we hope to continue with the program. I also am doing the Men's Health League. Right now, we're doing it virtually on Wednesday evenings, once a month. And for a lot of men who can't make it to the barbershops, it's just a way of them to have a peer-to-peer support to talk about various issues affecting them. And it helps looking around the Zoom that other people are like you and able to. Hello?
Okay, well, we'll ask you to ask everybody to mute. So if you're not speaking, go ahead.
Sorry.
Wrap
Okay,
it
sorry.
up here,
So just basically it helps men to, have a conversation with other Black men and help heal and just work together and build a good network. Thank you.
That's wonderful. Thank you. And Devon, over back to you for your final parting shot.
Yeah, I'll just wrap it up very quickly. Thank you, Sharon. So I just want to say we do have a partnership with Cole Harbour Mental Health. Stephanie Bezess is on the line. She works out of our clinics in the Prestons. I'll let her speak to that, but I think it's about a month turnaround in getting to see her. But that is a super expedited process as well that we offer to the community. And then we have culturally specific anger management as well for our folks. And then how our service is different. Obviously, we take we use a cultural specific lens to programming and providing services. So all of our staff team is of African Nova Scotian descent, so Black. You know, there's very short turnaround. There's next to no waits for all the partnerships and services we offer. And then gender specific. So for men and women, we have those appropriate people to work with them. And then one of the biggest challenges is just breaking down stereotypes for Black men to access services and care. So really just getting through to them and getting them to come in and you know, just even see the family doctor. It can be a challenge there. But you know, Dr. Ron's great at what he does. He's great at making Black men feel comfortable, and they don't even know that they're seeking or getting counseled when they see him, and that there's a referral coming because there's you know, some underlying issues when the onion gets peeled back. But so that's a great piece. Obviously, with being a part of the Nova Scotia Health Authority, there's red tape and bureaucracy that we have to navigate as both as Black staff, but as a Black program, right? So we have to always be creative and one step ahead of that Eurocentric way of doing things. When it comes to our programming and the services we offer, we're often told no, and that we can't do stuff from, you know, our own organization. And we have to be advocates for our patients all the time. And then when we go out into the community, we're also, you know, tied up with red tape and stuff like that, that we have to navigate and access and fight and, you know, go around or through walls. So that's the biggest one. And lastly, I'll just say collaboration. You know, our team is small but mighty. We are growing, but it's important that we share information and you know, give shout outs to the other organizations that are here and that aren't here and work together, right? There's enough work for us all to go around. I find that we get caught up in the personal stuff and we don't need to, right? So we're here to help folks and we're here to, you know, change lives. It's a very crucial time right now. The climate, both globally and locally, with Black men being shot and killed is alarming, scary, worrisome. So, you know, we have a lot of work to do, and we have to address the issues that surround mental health and put our best foot forward. So I'll say that and I'll leave it there. And I'm just happy to be on the call, even on a Friday night. So thank you.
Well, thank you. And my goodness, what a rich variety of services. Very impressive. And I know it's even growing more. Dr. Vincent, you can wrap that in a lovely bow. We're looking forward to hearing from you now.
No, thank you very much. I'm sure I won't take all the 7 minutes because they've done a very good work already incorporating psychiatric piece into the work that they do. So I've been in Nova Scotia since September, and even before coming here, really I was attracted to come here because I understood my brothers and sisters were concentrated in this part of Canada. So I accepted the job to come here because of really having heard that there's a strong African Nova Scotian community here. And we thought it would be useful for us to look at how best we can be able to support our brothers and sisters. I was so excited to hear there was one of my brothers who was already supporting the African Nova Scotian community. But unfortunately, before I could even bring him to my office to talk about what next, he sent me an email to say he was on his way. pursue some other interest, which is all good because it's all helping the community. So we thought we need more creative ways of really supporting our people, which does not depend on just one a psychiatrist from point of view of physicians, because we want to be able to create a system that's robust, depends on many people. If even one go, the others will be there and stuff like that. So we came together with various stakeholders, and we've designed a system of having several psychiatrists volunteer to go to the Brotherhood Clinic 1 day in a month on a consistent basis to provide psychiatric care with the physician in the Brotherhood Clinic. We are committed to doing the same for the Sisterhood Clinic. There's already an African lady psychiatrist from Dublin that we've recruited, signed the offer of lead employment. So hopefully she should be with us in September. And I'm really looking forward to her coming to the Sisterhood Clinic in particular, because I think the Brotherhood Clinic have a lot of men, and the Sisterhood would also benefit by having some female psychiatrists as well. So we'll continue to work with the Brotherhood and the Sisterhood Clinic. Some of those who go to the clinics also work in our community mental health program as well. The clinic, we go and we provide mostly consultation services and advice for the family doctor. But if people require more ongoing support, then we are able to connect them with some of our psychiatrists who work in both the Brotherhood Clinic and also in our community mental health program. We also are looking at how we can be able to expand access to care for the entire community. We've been advocating for the establishment of a rapid access and stabilization program. Fortunately, we got the ear of those who really matter. The CEO, Karen Opfield, has been very supportive in helping us remove some of the roadblocks. And we've had approval for about 4 new therapists to be recruited to support a new service, a rapid access and stabilization program, which is going to have 2 psychiatrists on site from 8 a.m. to 5 p.m., 5 days a week. That's the initial phase. If it's successful, we are going to extend it to 8 p.m. and also make it a 7-day service, similar to the service that I came from in Alberta, where we had the Access 24. So that's really exciting. Last week, we got approval for space to be provided for this service as well, again, from Nova Scotia Health Authority. And I'm really grateful for the speed with which they are supporting this particular initiative. We believe is going to provide another avenue where you don't have to wait a long time before you get access to both, mental health support as well as psychiatric support. So these are some of the initiatives that I feel will be very helpful for the community going forward. Thank you.
Thank you, Dr. Vincent. That's just so exciting. We are really, really blessed to have you with us and to be making all of this additional change and building our support and our infrastructure. Thank you for your work. So we have now time to hear from Stephanie and Kaisha. We'd love to, you could take all of your 7 minutes. So over to you.
Thank you. I'm just going to share. There we go. Right. Can everybody see that? Or are you just seeing like a black background in my notes?
We're seeing it. We're seeing it. It's not, we're seeing, it is able to be seen. It's not a big slide. It doesn't take the space, but.
We're seeing the presenter view.
Is it?
Press display settings and you can change it to swap it.
Okay. Where is Stephanie? Have we lost her?
I think.
Okay.
She froze.
Oh,
She
there she
froze
is.
for a
Okay.
moment.
Okay, all right. Stephanie, just go, girl. Just
I
take
was
it
like-
away.
It's just gone. That's not at all surprising. We'll use it from the small screen because I'm not sure what happened, but
Okay.
we'll take it through from there. Technology, love it when it works, hate it when it doesn't.
Mhm.
So for myself, as I was saying before, is that gonna? There we go. So yes, so my name is Stephanie Mazeth. I'm a clinical therapist along with being a registered occupational therapist. And I work out of the Cole Harbor and Eastern HRM Community Mental Health and Addictions Clinic. And I let Kaija introduce herself and her role.
Okay, yeah, so, sorry, I thought on the slide, I thought I was down, so my bad.
Oh no, yeah, this is just like the beginning with your beginning info.
Okay, so yeah, I work at the Cole Harbor Clinic as a community outreach worker.
Perfect. Yeah. So we are kind of the community team in the fact that Kaija does go out and does like a lot of community visits and navigating for resources. And then myself, I work at the Cole Harbor Community Clinic, but I also work in North Preston and East Preston, as Devon mentioned earlier. So the communities that we serve specifically is Cole Harbor, Lake Echo, Mineville, Porters Lake, Musquodoboit Harbor, and then along the Eastern Shore out to Sheet Harbor. But we pay special attention to the Preston Township area. So my role is specific in the fact that I'm a designated position, and kind of it's 50% of my role is the general population that's served through Cole Harbor, and then the other 50% is specific to the Preston Township area. And so there are some exceptions that apply to out of area folks that I see, which I'll touch on in a minute. So as a clinical therapist, basically we serve folks who with moderate to severe mental health and addictions. So again, that could be anything from mood disorders, depression, anxiety, complex grief, personality disorders. We have a lot of folks with the diagnosis of borderline personality disorder that we see in our clinic. Also areas of psychosis, so schizophrenia, bipolar, along with addiction. So alcohol, drugs, gambling as well, all fall underneath that umbrella. And so treatment, I put like psychotherapy with an asterisk there, and the idea that we approach it with a trauma-informed lens. It is in the idea, like modalities of very kind of evidence-based practices of cognitive behavior therapy, dialectical behavior therapy. But I put an asterisk there because with Black folks, it's not always that idea of we're just going to challenge thoughts and try to cope with emotions. There's a lot more going on there. We do a lot more of a holistic approach in looking at the whole person and also looking at the community at large when we're trying to deal with people's mental health. And so it's the idea that when folks come to me, it's not the idea that everything is necessarily always goal driven. That's certainly a part of it, but it's the idea too that you get the time to get to know me, be able to kind of like trust in the process, because yeah, there's a lot of stigma that comes through it. So I understand coming through the door is also a very difficult process that I want us to be able to kind of unpack things first before all of a sudden jumping in to be like, okay, we're working on this function and we're going to use this modality and this is going to go through. We know that that doesn't work. I said, I've actually had many lovely conversations with Robert Wright about the fact that a more holistic approach for folks is usually what works best in the Black community. We also offer groups. So we have a DBT group, an anxiety group, depression group, and I know that Kaija also runs some other groups as well that I know she's going to touch on. And we have also now had the opportunity for doing family education for Black folks in community. So myself and Elizabeth, who's the wellness navigator who we just met through the Nova Scotia Brotherhood, we recently just did a training through the Schizophrenia Society of Nova Scotia, which has now actually been changed. The name is now Hope for Mental Health. And we've just did the training process for Families Matter program, which is an 11-week program. And it focuses on providing education for families of how to care for their person who has like a mental illness, and as well as how to care for themselves. Because it's the idea, again, that you cannot give from an empty cup. So it's a lot of that focus on self-care for the families, along with how to care for their loved ones and how to advocate as well. And then I'll let Kaija speak to her role.
So thanks, Stephanie. So yeah, so my role, I have a really special role. Actually, the clinic wanted to make sure that they had someone who was racialized in this role, which is not really what you hear of too much, especially kind of back couple of years ago, but I was really shocked, but also excited to be here. So part of my role, I kind of do some different things, which I'm going to get into. So the first thing is informing individuals on the services that Cole Harbour Mental Health and Addictions Clinic offers, and more so NS Health. So I have a really unique role of most times being the first person that an individual will see before they come into our services. So what I might do is if folks are have some questions about what it looks like, I may call them or meet with them in the community or meet with them one-on-one to really explain the services we offer and kind of what the process is to kind of connect to those services, which I think is really important. The next piece is community navigation to resources in the community, which is a very broad topic because I think community navigation can be anything towards finances, housing, helping with, advocacy, getting connected to different services. So I do a wide range of that work with folks. And because I'm an individual of African ancestry, I have the privilege of working with individuals of African descent and really being able to provide that cultural and Afrocentric lens, especially when it comes to navigating through our Eurocentric system, racism, and what they may be dealing with in our system or outside our system as well. Another big important role is collaboration with the community. As Stephanie mentioned, one of our goals is really to repair the relationship with our Black communities and racialized communities. NS Health, and especially folks at the clinic, are very aware that, I think someone, yeah, okay. Okay, sorry about that. Folks at the clinic, and I think folks folks higher up are aware that NS Health historically, respectfully, has not really had the best relationship with our racialized communities. So that's why when I say repairing, we are trying our best to really repair, and we know that it's not going to happen overnight. So one of the things that I try to do is do events like this, which I'm very privileged to be able to work with Miss Sharon and Miss Donna, but also going into the community of other community places and allowing folks to know what our services do, and really to be that connecting point if they have any questions or if they have anyone who may need support and are a little bit maybe confused of, what's the first steps to take. Also, I run groups. So I run stop smoking groups with other COWs, community outreach workers, a structured relapse prevention group, and early recovery skills group, which is for individuals who are experiencing addictions. Mostly because of COVID, the Stop Smoking group, we have just started being in person, but due to COVID, we did do some virtual groups. And then I will be running the Affected Others group, which is similar to the Family Matters group, but different content, but just supporting individuals like family and friends, help support their loved ones who are experiencing mental health and addiction challenges. And then the last piece, advocacy. So anyone who knows me knows that I am a big advocate, especially for folks from marginalized populations. So that's a standpoint that I personally take, respectfully, of course, but talking to staff, making sure I'm asking those critical questions, and making sure I'm doing it in a way to create more resources for folks in the community who are experiencing mental health challenges and addictions. And like I said, just ensuring that I'm also respectfully educating or kind of talking to the staff at the clinic to make sure they're fostering that cultural lens, or even my managers when I can. So that's a little bit about my role. Very good.
Okay, and we're okay. We have one or two more slides. All right.
Yeah, just a couple.
Yes, that's like very quickly. I'll go through. So the referral to our services. So community mental health and addictions. It is a free service. It is hosted by Nova Scotia Health. So with that free service, waitlist can be long. So you can self-referral, and we have a centralized intake with with a 1-855-922-1122 phone number. And the thing is, if you're within those kind of catchment areas I mentioned before, when it's put forward, you can actually ask to be on my service. And so therefore you are connected to a Black clinician to be able to speak to. I will say a little caveat about central intake. A lot of the time, they will look for specific things in regards to mental illness that sometimes in like the description, they will then say is not moderate to severe enough. And so I always think when people call up, I always say it's not a time to kind of like shy away from like the impact your mental health is having for you, like how you're functioning, how you're sleeping, and your ability to go to work, how you're able to care for your family. All of those things need to be mentioned so that you're able to provide you with service. And then also for folks who live in the catchment areas, especially in the Preston Township area, I also receive direct referrals from family doctors and other health professionals, and that are faxed directly to the Coal Harbor Clinic. And that's almost my own little like rapid access way that I'm able to get people in faster who come straight to me that live in the area. And then also that caveat too is I partner with the Nova Scotia Brotherhood, and Dr. Milne, Devon, Elizabeth also send me through referrals that I'm able to fast track a lot faster too. And so some of those folks are outside of our specific catchment area, but we just want to make sure that those are folks that they identified as urgent needs. So we want to move them through as fast as we can. And so, yeah, and again, I work out of Coal Harbor Place Community Mental Health and Clinic, Addictions Clinic. Usually I'm here for sure on Tuesdays, Thursdays, and Fridays, North Preston on Wednesdays, and East Preston every other Monday when the clinic is open there. And then I always leave like my contact information because I know there was a lot of things covered very quickly, but you won't, like you can call into the Coal Harbor Clinic and you'll get a chance to talk to our clerks. You won't be able to talk to me directly, but they can always leave a message. And then when I get a chance, I can get back to you to answer kind of any questions or anything like that that may come up. And then that's it for us. Thank you.
Okay, well, thank you so much. And there will be, there's a question for you in the chat. Sister Lano had a couple of questions, but we'll get to that after we hear from our final presenter, and that is Krista. And over to you, Krista.
Thank you. I'm just going to share my screen here. Hopefully it works. Can you all see that?
Yeah.
Perfect. Okay, so thanks for the opportunity to speak tonight. I very much appreciate it. I'm here from the Nova Scotia Early Psychosis Program. I am a registered nurse and I'm working as a community mental health nurse right now. So just quickly a little bit about our program and what makes us different. Specifically is that we are a specialty service. So we provide specialized treatment specifically to people who are experiencing psychosis and the associated disorders. So we're community-based. So we are in the Abbey J. Lane building, but we are a community program. We focus on young people, and we have a wide range of mental health practitioners who have specialized skills and knowledge in early detection and treatment of first episode psychosis. So our mission is that we're committed to improving mental health and quality of life for young people experiencing a first episode of psychosis. And we do that through promoting early detection and providing optimal and timely health care. And everything we do is based on the most up-to-date scientific evidence and standards. Our philosophy and values are especially grounded in the fact that although psychosis is a serious disorder, it is absolutely treatable and people can go on to live full, healthy, happy lives with the right treatment. And in order to do that early intervention, we strive to provide quick and accessible assessment and treatment. Very quickly, I'll just say for people who aren't super sure what psychosis means, because it's a very broad term, it's basically just conditions that affect the mind. And there has been some loss of contact with reality. So it can affect a person's ability to think, feel, act, again, how they connect with reality. It can affect all five senses. What I really want to stress here is that it is a medical illness, just like heart disease and diabetes. It just indicates that there's been a disruption in brain chemicals and it affects how a person functions. So yeah, we like to stress that it's a medical condition that affects the brain, and that supports people in seeking treatment when they look at it as a medical condition instead of sort of a problem or a mental health issue. So anyone can be referred to us within the Central Zone, ages 12 to 35. We are partnered with the IWK, so we provide across the range of ages. And for people who are showing symptoms of psychosis or have been diagnosed with a first episode of psychosis. Anyone can refer to us. It's completely open. We get a lot of family members, partners of people calling in to chat. They would speak with me as the intake coordinator. They can tell me what their loved one is experiencing. If we feel like, hey, yeah, this is sounding like a psychotic disorder, then I would try and connect with the person themselves, because of course we need consent before we look at their health records or book any appointments. But working with families, we're pretty good at getting people to come in for their assessments. Lots of people refer themselves like, hey, things have been a little weird. I don't feel quite like myself. I'm having these symptoms. We talk about it and decide if this is the right place for them. So if you're unsure or you're just seeing like some glimpses of things going on with your loved one or yourself, you can always call in, we can chat, and we can sort of figure out if this is the right place for you. And if not, I can help connect you to where it might be. So specifically, I'm here tonight to talk about the Your Mind Matters project. And this is based on a study done by Dr. Ingrid Waldron and Dr. Jacob Cookie, along with clinic members right from Nova Scotia Early Psychosis. So the background of this study is basically that Black and African Canadians are disproportionately underrepresented in early psychosis care. So for example, at our clinic, it was around 7% of our clients identify as Black Canadian, which there is no scientific evidence to show that it's experienced at different rates among different races. So Dr. Waldron and Dr. Cookie wanted to find out why that was, and they wanted to reach out to African Nova Scotian adults and help them recognize early warning signs of psychosis. They wanted to look at the perceptions and beliefs about mental illness in the HRM, and to talk about perceptions and belief about help seeking. So in these, so they did so by holding a study with 75 participants from Dartmouth North, North and East Preston, and the north end of Halifax. And these were focus groups run by community leaders in those communities. So what came out of that is obviously there are a lot of barriers to care, and that was the underlying theme throughout. And there are several reasons for that. Some of the key ones listed here are avoidance, so just not talking about the subject, stigma from others, and self-stigma as well, fear of police involvement if they do reach out for help, and just overall lack of trust in the healthcare system. So then they asked what would facilitate learning and where can opportunities for learning be found. And the youth and their families in these focus groups said, like, you just need to build on the relationships that are already there in the communities. Those are the people that we trust and that we turn to. And that's really where you need to lay your foundation. And I think this is just a really great quote from one of the caregivers involved. She's basically saying, like, you just need to come to the community, give me the information so that I can have those conversations. So with that in mind, we wanted to move forward with one of the main recommendations, and that was to offer training and education to church ministers and other spiritual leaders in the communities. So we were lucky enough to partner with the African United Baptist Association. We just finished a 4-part education series with them, and we're going to be doing an in-person workshop in the fall. It was really great. It was a knowledge exchange, really. We got to learn about their communities, and they learned about psychosis. So it's a great partnership. Our greatest challenges are just reaching young people at the beginning of their illness. So sometimes young people will hide their symptoms or mask it with substances. And the longer they sort of mask those symptoms, the more severe they become and the harder they are to treat. So we really just want to get those people in to see us as early as possible so we can start to help them. There is also the difficulty when a person who's paranoid as a result of the illness, because that is a symptom of psychosis. And then finally, communicating the effects of substance use on symptoms. That's a challenge because many young people see using substances as part of their everyday life. And so we have to really stress the importance of not using them. That's everything. Thank you so much again. My contact information is there. I'm happy to chat. Thank you again for your time.
Okay, thank you so much, Krista, and thank you to all of our presenters. This is a really important time to hear from our participants who have questions. There were a number of questions in the chat anyway, and Sister Donna, maybe you could reference the questions in the chat and get the people who are asking them to ask them. I certainly have seen Sister Lana and Sister Rose. But over to you to call on them to ask their questions.
Yeah, I think there was a question for Lisa in the chat. Let me just bring it up here.
Yeah. And
Whoops.
Cynthia asked the question, didn't she? Yeah.
Yes, Cynthia, question for Lisa. What's the fee for services for the neurofeedback package, and is it covered by insurance?
A great question. So it depends on your insurance provider if it is covered, because we can get it covered if you have occupational therapy services. Other than that, it isn't. People pay out of pocket for a package of 21 sessions. That includes the QEEG and the 20 training sessions. We're looking at an investment of $3,000. However, I say that also to say that we have a third-party payer who can give you the money, and then you can pay them back in installments to make it easier. So there could be a payment plan for that. And depending on the person's situation, we can also make it more affordable as well. I don't do it for free, only because I find that in this particular intervention, I feel people don't value it, and then I have a lot of no-shows. So it's a commitment, and it needs to be twice a week minimum.
Thank you. And Rose had a question as well. Her question was, are there residential addiction treatment centers in Nova Scotia that will admit clients with mental health comorbidities? So I guess anybody can take that question. Maybe Stephanie or Kaisha, would you be able to answer that question?
Just for clarification, is Sister Rose talking about public or private?
Yeah, that's what I was gonna.
Sister Rose, go ahead. You're muted, Sister Rose.
Mute. Yeah.
Yeah, there you are.
I was thinking of private, addiction treatment centers. I think about that because, of course, in all of our communities, we have people who have addictions, and sometimes one of the things that does help is being away from the situation. And so I know of one place, it's called Ledge Hill, quite an expensive place. And, I'm not sure if we have anything else in the province. So I'm just kind of checking things out to see what's available.
Okay, Lana, did you want to speak to that, or I can speak? Oh, you're muted.
Lana's you're muted, Lana.
Because I have a couple.
Yeah, so I really don't. It's one is no better than the other. Let's just put, when you're talking private, you're talking about money.
Yeah.
So from our church family, which is New Horizons Baptist Church, and the AUBA have an affiliation, very loose affiliation in terms, but do sponsor folks to attend the Teen Challenge program, which is in New Brunswick. And what we do know is from the men, and it's a men's specific program, has a faith-based part of its principles. It's not like a heavy in AA or anything. It really is about looking at faith and spirituality as part of your guiding tools. I can only speak about the success our church family has had sending Black men to those programs and supporting Black men to attend those programs. So that's the only program I can speak to clinically, but there are some small private folks here like Ledge Hill. And then there's some then there's other programs like Al Care Center and other folks that are here. I think the challenge is doing an inpatient program that's so close to home can actually, at least the feedback I have heard is it's easier to get clean and sober when you're not around the prompters and the events and the things that are close to you. So being treated out of jurisdiction tends to be people tend to have a more success than being treated even locally. So the move towards, programs that are community outpatient based, my feedback that I have heard from my clients, and I don't treat a lot of addiction folks because I do believe it requires an interdisciplinary team versus an individual clinic. Unless folks, can get literally time out, time away to get a level of sobriety before they come back and connect with programs locally, Sister Rose. That's what I have heard has been the most successful. Maintenance happens close to home. Treatment happens further away, I guess is the way I consider it. But yeah, and I think Cynthia's experience with the military is, can give you that kind of a sense as well.
Yeah,
and especially in child and adolescents, I'm not to speak for the IWK, but their choices program or their intensive case management services programs have some variation as well.
2 questions up here, Perigic and then Cynthia.
Oh,
Please
that's
go ahead.
Paris.
Hi, I'm Juanita
That's
Paris.
Juanita.
Yes.
That's Juanita.
Hi. I don't have a question, but I did want to speak on the services. Now, I'm a registered social worker, but I work for the IWK as a diversity workforce advisor. And I did work out in the Marguerite Center. It's an addiction center for women, and it is spiritually based, and it's out in the Tantalent area, and it's still actually in service, and it's particularly a lot of it is run. It's I guess we would call ourselves, it was like for profit, because there was a lot of social services assisted a bit, but we had to raise our own finances and so forth. But it's still running, and it ran for a number of years by a number of nuns, but it was Catholic nuns, but we gave like spiritual care, we had groups, individual counseling, and it's still, I was just looking on the net, it's still there. So it's way out in Tantalent. Yeah. So I just wanted to inform people of that. And there were quite a few of women of color that did access it at that time, like maybe 1 or 2. I guess that's not a lot for our community, but at least there were some. So I wanted to let you know that.
Thank you, Paris. And sorry, I mispronounced your name.
Oh, that's okay. That's okay.
And
I'll know it forever now.
Yeah, that's right.
Just really quickly though, too, because I just called them last week. They are open to working with folks with regards to payment. So if folks are on income assistance, they'll work with the individuals to try to figure out the funding piece, whether it's income assistance or disability funding, if folks don't have the funding. So that's also another thing. And there's a couple more, I think, in Nova Scotia too, Mrs. Rose. So yeah.
Yes, there's Crosby House as well. That's in New Minas in the Valley. It's also another private addiction center.
Yeah, and then Eagle Nest Recovery House and Terradine Wellness Center.
So I'm wondering if those names of the places, and maybe if you have the contact information, if you could kind of forward that to Hawk, and so make that a
Yes.
part of the list. Yeah.
Yep, I can do that. Yeah.
Thank you.
I will as
Thank you so
well.
much.
There is another question in the chat. Lisa, I think you were asking a question. For those people working with addictions, do you refer them to AA or Al-Anon? I guess
So I'll
Aisha.
I'll answer that.
Okay.
It's very dependent on the individual and their aftercare plan, whether they would want to be referred to AA. It's as you know, AA is very self-directed in terms of if people choose to go, there's no real structure to it, but it can be very helpful and very successful for some folks who buy into that particular service. And as well as Al-Anon is for partners of, and definitely, yes. We don't see a whole lot of that, or I haven't seen a whole lot of that uptake in terms of the African Nova Scotian community. It's very rare that we see that particular service being utilized by members of our community. And I'm sure there's various different reasons as to why, but definitely if they identify that peer support is something that they are interested in, absolutely, that would be part of developing, you know, their aftercare program once someone has attended, you know, a number of sessions or drawing intensive treatment or aftercare.
I don't see any other questions.
Other questions? Okay.
I think though Lana mentioned something very important at the beginning, kind of asking folks how the data is collected, but I don't know if you, Lana, if you were just asking, because Devon did answer it, but were you asking specifically from us or?
Oh, my question was because you are both Devon's program and your program is embedded within the Nova Scotia Health Authority. And I'm going to lean into Ms. Sharon around desegregated data. So, excuse me, as you know, and I know, there is a, the way in which funding and funding dollars and, you know, can be allocated is based on how many people are using the service. So I'm curious about how the data, because one would, you know, the assumption is everyone who comes in who's to the Brotherhood would be of African Nova Scotian descent. Because I think Stephanie's a 0.5, not all of her data would necessarily be reflective of people of African descent. So my question is, how is the data being collected? How are you disseminating that data? How are you desegregating that data? And what does the data tell you?
It's a really good question.
Yeah, well, yeah, I was gonna say I can speak to you a little bit. So the referrals that I receive and the folks that I have, it's very old school, but all of that data is then separated. All of their files are kept separately for myself, but they're also captured in our scheduling, in our PHS, so they become like a registered person. So if we went through with folks and kind of like pulled that data, we would have those names of anyone that I had earmarked. And also that data gets collected. If you go through central intake, they ask for that racialized data. So that can also be pulled to see who's using the service as well.
So my other question around data, so because of partnerships, and it's partly that's a little nerd piece of in me, right? So I go to, I'm a Black man, I go to the Brotherhood, I see Dwayne. Dwayne gives me as a one encounter, then he refers me to you. I'm a one encounter to you, you're counted twice and I'm one person. So the data can be skewed. So I'm curious about how that data is an accurate reflection about the numbers of people of African descent are actually seeking service, what kind of services they're seeking. So again, Sharon knows my big thing is around data too, is how is it attached to MSI? Or are we just rudimentary pulling data together to say, anecdotally, this is who we're seeing, this is the presenting issues, and yada, yada, yada. We don't have a complete picture as we are, and I want to caution us, as we develop and move forward with programming, our data has to be able to accurately give us a picture of who they are, who we are, what we're presenting with, and what is our outcomes. And what are because when the question is, what are the gaps? I can't tell you the damn gaps if I don't know what the options of service and presenting issues are. So from a systems point of view, I would challenge Nova Scotia Health and certainly the IWK or the big animals in the province about how are you looking and gathering data. So we can have an accurate picture about the percentages, not generic numbers, but the accurate percentage of who we are and what we're presenting with. Are we presenting with complex, complex grief? Really, that's an adjustment disorder, right? If it's psychosis or prodromal issues, then you got prodromal, and then where those pieces of the pie. If it's anxiety, there it is, right? So our codes and the DSM-5 will give us some indicator of what people are presenting with, but and I know people don't always put their F codes in. So that becomes problematic, and it's an issue of rigor, and it's an issue of at least for me, my years of working at mental health and addictions, that not everyone was consistent with the way in which they code, and the way encoding in healthcare means dollars.
Well, that's actually very important to us as we move on as a nonprofit who's interested in health policy and certainly interested in measuring, because what isn't measured doesn't count. So so thank you for raising that, and for our colleagues, you're in your practices, and I would ask you to think about that and come forward. Lisa, you had a question.
Just regarding the whole Al-Anon AA, I'm very curious. Adverse childhood ACEs, right, is we have lots of alcoholics in our community, lots of family members. Al-Anon is not just for the partner, it's also for the children of the alcoholic. I'll say right up here that I am a member of Al-Anon. I grew up with an alcoholic as a child, and Al-Anon has been very helpful in my healing. And I can tell you from experience that in all the rooms that I've been in over the 17, 18 years, I've never seen a black person in that room with me. Never. That's a long time. Never seen a black. So I think it's more because maybe they don't know about it, or but I'm really interested in starting up a Black Al-Anon group, or Blackish, meaning there would still probably be some white people there because there aren't any other Black Al-Anon people except for myself. So I'm just putting it out there. If people are coming across people with addictions that might be open to it, send them my way. I want to see what I can start up there.
That's great. Thank you very much. I think Paris had her hand up, Donna, and this will have to be the last because time, is going. So Paris, please.
Actually, that was a mistake. Sorry.
Okay, great. Legacy hand. All right. So
okay. I'm just going to check. I'm just checking the chat. I don't see any more questions. Okay.
No. So you have a statement, and then Kaisha, and then me.
Well, first of all, I want to thank everybody. This was really fabulous. It really certainly helped answer a lot of questions, certainly from my perspective. But I just wanted to tell you that so tonight's has been recorded, and you can view it on the Hack YouTube channel for if you want to see it again, or for those who couldn't attend. And yeah, okay. And Kaisha, I guess you're going to invite people to send email information to us, or info@hack.ca, if you have any further questions or concerns that you would like us to address.
Yeah. So I think, yep, for sure. So I think that was also if folks have questions specifically for some of our NS Health colleagues on the call, that those emails will get sent probably to me or Stephanie, and then we'll make sure that they get answered or they're sent to the appropriate person.
Okay, and thank you very much, Aisha, to all of the presenters and to all of the participants. This is so good. I mean, we needed another hour, but we don't have it. So, but you can get it on our Hawk YouTube channel. I also want to say that that visual that Kaisha offered at the beginning is hugely important, because people need to know where they can find you, where the number is, how to get it, and we will have that on our HAWK website. I would also ask for all of you sisters and brothers working in this field to make that visual available in your offices, make that visual available everywhere, so that people can have access and know who to call and when to call them. All right, I'm asking for that. And Kaisha, we will definitely put that on our HAWK website.
Yeah.
Thank you.
There's also a suggestion that we should have a directory. So
Right.
people, that would certainly follow that visual that Kaisha put out.
That's
Anyway,
right. That's right.
yeah.
Our people need to know how to navigate services. We didn't talk about the lack of services for incarcerated people this evening. So ask your question so that we can send information to you, and add that as a very important component. Thank you so very much to all of you, and
night.
have a good weekend, and let
Yeah.
this be the beginning of improved mental health for all of our people. Thank you.
All right. Thank you,
Good
everyone.
night.
Good night.
Night.
Bye-bye.
Bye.
Night, everyone.